We are making some progress in combating the opioid epidemic. I think those numbers are still coming in, especially locally, but on a national level, numbers show we are reducing overdose deaths in the ballpark of 10%, 15%, which is really compelling. I did see just last week that we also know CDC data shows that the death rates are not decreasing amongst our Black populations and our Native populations. So that is a red flag that we must double down on and look very closely at.
And so you said something about naloxone in our patients, and very few of them are actually, getting prescribed naloxone. I just find it's very hard to prescribe naloxone in the emergency department because most people don't want it. And so there's still, you have to, prescribe it to somebody who's actually going to fill it out or can afford it. So, we've been directed to, prescribe naloxone for some time now. But I find so many people don't want it, won't fill it out, don't have the money for it, are not interested. And most of them are mad that we gave them naloxone because we withdrew them. So I think there's a real barrier to the prescription of naloxone. It sounds really good that everybody in the emergency department gets that's prescribed an opioid, gets naloxone prescribed as well, but very few people want it or fill it out.
As many of us know, behavioral health here in 22, and those, as many of you know, they're the results of government settling with pharmaceutical companies that had a role in driving the opioid epidemic that we are still in. And one of the things you're going to hear from DHS is that about $127 million in calendar year 2024 has been dispersed. And just for context, in calendar year 2023, we were around 80 million. So that is a large amount of money. As many of us know, behavioral health here in Illinois and in other states is funded primarily through private insurance, a combination of private insurance, a combination of public insurance, other state funds, and then self-pay. And so what we're talking about today is a portion of the other state funds that go to behavioral health in Illinois. I always like to say for the record that when I say the word behavioral health, I mean it in an all-encompassing way. It includes mental health issues, addiction issues, recovery, harm reduction, and trauma support. So you're going to hear that word a lot today, and those are the many things that it refers to.